What's up, guys? It's Connor Coleman. I'm a student physical therapist assistant, and this is.
Jacob Gamble, a student physical therapist assistant.
And we are doing our project today on the study of home health. So let's get right to it. So, what is home health care? You might ask. Home health care provides medically skilled care, especially SNF training, to patients in their own homes. Services require a doctor's order and are intended to help individuals who can't leave their own homes, who may be bedridden, to receive the medical treatment they need. Home care is usually less costly, more convenient, and can be just as effective as hospital care. So, some of the things that we might do would include vital signs, range of motion, MMT training, strength, checking to see if they're following their HEP, monitoring what they're intaking, food, medicine, making sure they're not abusing that, adjusting their home layout to benefit the patient's needs and prevent falls and future issues. Sometimes we might even do wound care on them, and we do a lot of education about them being independent with their self care so they can achieve full independence. Advantages for the patient in this case is they're in their own home and they're in the privacy of their own home, so they feel safe. Also, it's a one on one experience for the patient and the caregiver to build trust between the two of them. They're also safer from nosocomial infections because they're not in a hospital bed. They're in their own home, they can take care of themselves most of the time, and those infections are knocked out. Financial relief, the average cost per hour is only $23, so it's very affordable for people who need help. And the patient can also feel an alleviation of loneliness or abandonment within their own home. Some disadvantages, however, sadly, we live in a day and age where there are deficient caregivers that abuse them. In that case, they would need to report the abuse to the hospital. Also, there's a lack of emergency services. If there was to be like an autonomic dysreflexia event, they wouldn't have immediate health care because a lot of these guys live in the sticks and they wouldn't have immediate access to 911 and emergency services, which is sad.
And advantages for the PTA are you get to make your own schedule, which you can pick which days you work and which days you don't. The pay to time ratio is way better than if you work a regular outpatient job or another job. You typically work 8 to 5. When you do home health, you can work from like 8 to 3, and still you get more money doing home health than you do other jobs. The soap notes are simplified and more goal driven. Um, and if you don't like dealing with your coworkers, this is good for you because your PT is a phone call away and you can't bill insurance when you're both there at the same time, you and a nurse or you and someone else. So that's a good benefit to it. But also, the disadvantages are you don't really have no modalities. So if someone is in pain, you can't give them ice to get your workout going. So you have to plan ways around it. There can be debilitating home conditions, such as being in a dirty house or smokers, people who smoke inside their house. If you're not a smoker, you don't really want to be leaving the house smelling like a cigarette. But family interference can also interfere with your time with the patient. When you do home health, you don't really get the benefits you would if you worked at Shands or somewhere else like that. And if patient progress is your thing, you don't really want to do home health because most of the time you're just trying to get the person back to their prior level of function. And that prior level of function could be taking 5 steps from their wheelchair to their toilet. The average salary for home health care is 59,000 a year. It can be from 59,000 to 69,000, so there's a good pay range there. Um, you're given a caseload and you make your schedule more convenient for you and your patient. So if a patient can't be seen early in the morning, you can plan them later in the day. You're very flexible with that. And to be a home health therapist, you have to have a year of prior experience in another setting, such as SNF is most important because it's more similar, but outpatient would work just as well. And here's our references. But one of my buddies, he's works in this area as a home health PTA, and I got a lot of my information from him as well. So
So
thank
that's
you for
our
listening.
Yep. Thank you for listening, guys, and good luck with the rest of your semester. And we appreciate you listening to us today, and we hope that you found this beneficial, and we hope that you can become a home health therapist one day.